Good afternoon, my lord.
No, good afternoon, Mr. Stephen. We have a panel this afternoon, I understand.
We do, my lord. This afternoon we have a panel of 4 people representing member organisations of Befriending networks. Those 4 people are Miss Jane Burnett of Visiting Friends, Mr. Robin Miller of Cowell Elderly Befrienders, Mrs. Jo Sinclair of Carrigan Uist, and Mrs. Susan Smith of the Highland Hospice, appearing remotely.
Very good. Good afternoon to you all.
Good afternoon.
Good afternoon.
Right, now Mr. Stephen will have questions for each of you, individually or collectively, so I'll pass over to him. When you're ready, Mr. Stephen.
Obliged, my lord. And just for completeness, I should say that we also have pupils and teachers from Leith Academy joining us in the public gallery today also.
Oh, that's very good. I give a welcome to the pupils from Leith Academy and I hope you enjoy the experience. Mr. Stephen.
Thank you, my lord. Just a gentle reminder at the outset that these hearings are being transcribed and stenographers are noting down everything that you say and I say, so please do try and speak slowly and clearly and not talk over one another, and I'm sure that you won't. Thank you very much. Could I start firstly, please, then, by asking each of you to confirm your full name, your role, both now and during the pandemic, if that was different, and to give a short description of your organisation, where you're based and the work that it does. And if I could start firstly, please, with Ms. Burnett, and we'll work to Mr. Miller, Ms. Sinclair, and then we'll come to Ms. Smith on the screen. So I could start with you, please, Ms. Burnett.
Do we turn these on?
No, they're working
on
already, so you don't need to touch those. Thank you.
Good afternoon. My name's Jane Burnett. I'm the manager of Visiting Friends Befriending Service in Helensburgh. We provide befriending services to adults in Helensburgh and Lomond, and these are volunteers that we manage to provide a weekly visit to some of the most vulnerable people in our area. Thank you.
Thank you. Mr. Miller.
My name is Robin Miller. I'm the project coordinator of Cowell Elderly Befrienders. We provide services based on kind of 2 types of befriending, which is the traditional at-home befriending, and also we encourage people to come out in specially adapted minibuses to make friends with each other and stay involved in the communities.
Thank you.
I'm Jo Sinclair and I'm the project manager for Carrigan Uist, which covers the 5 island communities in the southern part of the Western Isles of Eriskay, South Uist, Benbecula, North Uist and Burnaway. We do the one-to-one befriending events and also we look after and support people living with dementia, and we also actually provide HR and governance support for alcohol and drug dependency as well.
Thank you. And Ms. Smith.
Good afternoon. I'm Susan Smith and I work in the Highland Hospice as the Community Partnership Manager. And we deliver, in addition to the clinical and personal care services in hospice, befriending support, which is about social engagement. We deliver that directly within Rochester and Inverness area, and we work with 13 partners throughout the Highlands to deliver befriending in their local communities. The majority of the services are a general befriending service for anybody of the age of 18 upwards, and it consists of one-to-one befriending as well as telephone support and additional support as well.
Thank you very much. Now, you all previously attended a roundtable meeting on the 8th of May 2024, and a written report of that roundtable meeting was produced and approved by each of your organisations. For the record, the inquiry reference for that roundtable report is SCI-WT0671-50 Now, we have limited time today, but everything that's contained in that report, and indeed any other documentation that you provided to the inquiry, will be taken into account, even if we don't cover it in your oral evidence today. But hopefully we'll still touch on the main issues that you wish to address. Time permitting, the intention today is to discuss matters, I think, under 4 broad themes or headings. Firstly, I'd like to start with a brief overview of befriending networks, and then what befriending is, for those that perhaps are unfamiliar with that concept. Secondly, the key issues and impacts experienced by those individuals and groups that supported by your organisations during the pandemic. Thirdly, the key issues and impacts experienced by your own organisations and staff during the pandemic. And then fourthly and finally, any potential lessons that you feel should be learned. And that could be things perhaps that you think were done well, but also things that you think perhaps the Scottish Government could reasonably do differently in the event of another pandemic or similar event. So that's the plan for today. If I start firstly then with the overview of what Befriending Networks is, and then what befriending is for those that are unfamiliar with it. If I could start with you, Ms Burnett, just to briefly describe what Befriending Networks as an organisation is, what it does. Thank you.
Yes, thank you. I'm a trustee of Befriending Networks in my role as a member of that network. So Befriending Networks supports and connects befriending services across the globe, and it provides training, events, resources and quality awards, as well as representation for our sector at government level. We have befrienders contributed more than 1 million hours of time to the befriending sector in 2023, and that was from a report that we did in that year. Befriending is a relationship supported by an organisation to enable meaningful connections. The befriending relationship has boundaries, and it begins with an organisation matching individuals together and then providing ongoing support to both the befriender and service user. The befriending relationship is monitored by the organisation and is supported at all stages, including managing the ending of that relationship. Befriending can be very diverse in its delivery, but it shares a common goal of enabling meaningful connections. The connection can be between people with shared or different life experiences. So some organisations are specifically for those with, say, Parkinson's disease. Others will be for a general group like the elderly. This connection befriending is a planned social interaction, and it can take place in a one-to-one setting or a small group setting, and can be delivered in person or at a distance, for example, over the telephone, letter writing, or even gaming. So it's very diverse in nature. Thank you.
Thank you. And could I just ask you to unpack slightly the relationship between Befriending Networks itself and the member organisations, some of which are on this panel today, please?
Yes, of course. Each of the members of Befriending Networks pays a small fee depending on the size of their organisation. They join the network, and as part of the network they can connect to each other digitally and in face during the year, and they can take part in training and their quality awards, and the value of having a network, what do you call it, a directory where we can look out for each other and find similar organisations to ourselves. So that's each of us here today is actually a member of Befriending Networks and really enjoys the benefits of having that connectedness, because we all work in we can be very remote and we don't see each other. So it's a burgeoning kind of area. So we get benefit from that.
And I'll ask one more question, and perhaps I'll let the rest of the panel contribute anything if they wish. Are there any particular reason or reasons as to why people seek the support of a Befriending Network?
Absolutely, because we do not have another kind of professional organisation as such. So Befriending Networks in particular gives us quality and standards and training so that we can achieve good practice. So what we're aiming to do is to make sure that we're working to the very highest standard, and by being members, that's what we hope to achieve. Does that answer your question?
Yes, I'm also interested in why people might wish to seek the support of a befriending organisation or network as well.
Because for many, many reasons, they know that, do you mean a client?
Yes.
Why a client might come to a befriending organisation? Well, there are many reasons which, by which people become socially isolated, or they can feel lonely. Loneliness is obviously a very subjective thing. Social isolation is very much more quantifiable in terms of the numbers of connections and opportunities to connect that people can make, and also it's a measure of how good a quality of those connections. For many reasons, people can become disconnected from society and their loved ones. We're talking about things like bereavement is a huge one, and being a carer is another. Having mobility issues or another health issue can make us feel lonely or isolated, and that's across the age range. So loneliness can affect us from, if you think of it more as it can be something that helps us to remind us that we need to go out and connect more with other people, but it can also be a debilitating state where people are unable to do that. And the problems of chronic loneliness are well documented, from physical harm to mental harm, and that's what Befriending seeks to address through that physical and emotional connection with people.
Thank you. And we'll come on to the pandemic in due course,
Sure.
but would it be fair to say then that people would have been seeking or using the support of these organisations prior to the pandemic?
Most definitely, and I think without exception, unless the organisation was set up that way, we would all be working with quite large waiting lists as well. So because most of the organisations rely on volunteers, there's only a very few that have paid befriending, and it's a different kind of concept. All of us would be working with a waiting list, and some of those waiting lists can be very, very long. You might have 20, 30, 40 people on your waiting list waiting for a volunteer to match them with. So, yeah.
Thank you. Mr. Miller, anything you'd wish to add on befriending more generally before we move on?
I don't know, speaking probably for all of us, just to add to what Jane said, that rural isolation is a big part of what probably all of us do, because we work in fairly remote and rural areas, particularly yourself. Yeah, but that's a crucial thing.
Thank you. Ms. Sinclair?
I think what we probably find up with ourselves in the islands is that there, because of the scattered nature of our communities, there's a lot of loneliness and isolation, and by and through the befriending, which is a very simple and basic model, you can stop the onset of dementia, because if somebody's not speaking or being with somebody or interacting with others, then actually, their general mental and physical needs become more. So we've got a situation here whereby if for the small value of the befriending agencies, and the cost of running a befriending agency actually impacts hugely on statutory services, because actually through the volunteers we're making sure that certain illnesses or certain things don't come on that would do otherwise, is probably the other thing that I would add.
Thank you.
Sorry, could I just add to that befrienders definitely do act as an early warning system often when statutory services are not involved. So, for example, if someone is being seen weekly by the befriender, they can notice changes in their health or mental health, physical or mental health. Yeah, would concur.
Mm-hmm. Thank you. And Ms. Smith, anything you wish to add on befriending more generally?
Yeah, and for us working in palliative care, we recognise the actual importance and the vitalness of providing good social connections as well, that it's as equally important to people as their clinical and their personal care health. So we see it as an integral part of people's overall life, and it actually promotes good quality of life as they're suffering from more degenerative illnesses, rather than sometimes people think of befriending as a nice add-on, and it's not. It's an actually essential and lifeline to so many people before COVID as well as after COVID.
Thank you very much. Well, against that background then, I'd like to move on to talk about the key issues and impacts that were faced by those that you supported during the pandemic. And that may include, for example, social or community isolation, and we've heard references to that already, access to food or food support, access to essentials such as prescriptions, digital inclusion, access to pandemic information, any disproportionate or unequal impacts that you may wish to highlight, particular groups, for example, and also any other key issues or impacts that you feel that are important to your organisation. If I could start with Ms. Sinclair for this one, and then we'll work our way, down the line. We'll then go to Ms. Smith, then back to Ms. Burnett, and then finally to Mr. Miller. And please feel free to build on anything that anybody else on the panel mentions, but anything else that's also key to your own organisation. So if I could start with you, please, Ms. Sinclair.
Certainly, I'm coming from the point of view, as I say, from an island perspective and the rurality of the island and the scattered communities. And I think, we had situations up with us on the islands that became apparent because of the way that the media are, that they think things in the Central Belt work differently, and cultures I don't think were recognised during the opening, during the pandemic, and so things weren't that would maybe have worked in the Central Belt or on the mainland didn't necessarily work within the island environment. We had sorry, can you just lead me on something and I'll go with it if you see what I mean?
Yes, of course. I mean, it's your evidence to give, Rudy, but I mean, social or community inclusion or access to food support, for example.
There were situations whereby we had very much a war effort sort of mentality going on with the folk on the islands, and they after a period of time we would discover that they hadn't actually been out to the shops. Their fridges were run down, their cupboards were empty, just because of what they'd seen in the media and heard, and on top of that they'd been told to make sure to wash things before and leave them to one side, and so even if something did come through the door, if a letter was posted, they wouldn't be opening it for a week in case there were germs on that sort of thing. So it wasn't even the fact that they were needing a food bank, because actually they had the ability to actually go and get food, but actually they just felt that there were other people more deserving or in need of it. So this is a situation that we found very much that people were just wouldn't, and then they were actually too scared to actually go through the door in case that thing got us. So yes, there was a lot of work, and it was very challenging to address situations like that, and those were people who weren't living with dementia or with a secondary illness or have a drug or alcohol issue. So yes, there was a lot going on there.
You mentioned those with dementia. Could I ask you to elaborate to what extent there was an impact on those with dementia in the community that you serve?
Those with dementia, I mean, we actually, prior to the pandemic, we used to actually have 4 or 5 individuals that would meet up on a regular basis as a group event rather than actually a one-to-one befriending. And they just didn't understand what was going on. The whole thing with dementia is no memory, so they really didn't understand the concept. Now, we went onto the telephone and doing telephone befriending for all of our service users, but they wouldn't even necessarily know who was on the end of the phone. So you'd send them a picture so that you could say, keep the picture next to the phone, so when you call, you can see who we are. But without, I would say that they all gave up. They all gave up. We did lose them all, and their deaths weren't actually from COVID directly, but they didn't actually keep on going because they didn't understand.
You mentioned their telephone befriending. What would have, and this could be for the community at large, not just those with dementia, but what was the access available to, digital inclusion, I suppose, digital support?
That was very difficult, the digital rather than the telephoning. I mean, the telephoning worked for a few weeks, but then nobody actually had anything to say to each other, so it actually again became very challenging for the befriender, because actually, and because they weren't the service users weren't necessarily interacting in the same way. They didn't actually have the ability or want to talk. They were, as I say, not wanting to socialise any longer and becoming more and more into themselves. But from a digital point of view, when the pandemic hit, we were actually issued with 30 computers to hand out to folks so that they could interact online and that sort of thing. Well, one thing is that I could say at that point, it has changed now, but there was probably about 50% digital poverty up with us. So therefore, these folk didn't actually have internet in their house, let alone know how to use a computer. And there was nobody in a position to be able to show them how to utilise these things. So all these computers were sent out with the best will in the world and absolutely not utilised at all.
And can I ask what that would then mean in practice in terms of being able to access pandemic information? And by that I mean perhaps the restrictions or rules that were in place at that time.
Right. For the individuals themselves, it actually meant that all they knew was from the television or radio, or if family members communicated with them over the telephone. For ourselves up on the islands, it was very difficult and very confusing sometimes.
trying to get hold of the most up-to-date information and how it related to and how we were meant to. You would actually speak to one person and they had actually taken it in one way, and you'd speak to somebody else and it had actually taken it another way. So again, there was so much confusion about guidelines and what was allowed and what wasn't allowed.
Thank you. Could I come then to Ms Smith, please?
Hello. Because I work in a hospice, some issues were easier for us, but more difficult for many of our partners. In that our partner organisations were much smaller, and when the blanket, to go into COVID, to go into isolation, and that had first come, a lot of organisations left all their notes behind, and they were all on paper, so they didn't therefore have information on each of their clients that they even had. They found it hard then to do communications with their volunteers and keep in touch with people, whereas it wasn't as difficult for us at the hospice having, centralised, and I was able to move over to an electronic system quite easily. So communications between health and social care, and managing to still keep in touch with the most vulnerable people in their communities, and actually managing to know who was struggling and when to put support in that in place. So I would say that one of the issues was not recognising the importance of social interaction and social support, and managing to have a cohesiveness between health and social care and personal care. I think in the hospice we had good links with our clinical and health care, and we put in an extra service during the COVID that enabled us to get referrals or requests right from the healthcare parts of the service to then enable that they were getting the social care support that they require. But we did still find that there were many people who, with the information that they were getting, were hearing that they weren't to disturb or to get in touch with healthcare professionals, and so they were really struggling at home and not accessing or receiving the care and support that they actually required for their ongoing health conditions. And many of their health conditions, due to that, deteriorated, which was quite sad.
You mentioned they're struggling at home. Could you elaborate at all on what those struggles were that they were facing?
Well, some of the struggles, our client group changed dramatically at COVID time. We've always had people from all ranges of illnesses and all age groups, but because all of the health groups stopped, and particularly in relation to people with dementia, who were used to relying on going to groups and interacting in that way, they all stopped and nothing else seemed to be put in their place. So carers who were given respite, who needed this respite to actually maintain the quality of their life and the quality of the person they were supporting, missed that respite, and nothing else seemed to be put in its place, and nobody was seeing these people to ensure that vulnerable adults were still safe within their own homes. So it was items mostly around dementia and support for people like that, not actually identifying who was now vulnerable.
Thank you very much. Can I come then to you now, Miss Burnett?
Surely. Our experience of the pandemic when it first happened was that we started to work from home, but we were trying to maintain 40 matches of varying sort of levels of support through distance befriending via telephone, and that was okay for some matches, but not for others, because some had dementia and you couldn't talk for half an hour to somebody with dementia. And then it actually was that you got to remember that the profile of a volunteer generally is that some of them might have been old and shielding also, so they were also scared and vulnerable. So we had to make sure that our volunteers were okay at the same time. And I suppose the thing that we did that was maybe different or similar to many organisations was that we recognised very quickly that there was a huge surge of community involvement with neighbours helping other people, but there was also potential for vulnerable people to be taken advantage of by cold calling and offering to help. So we felt that as an established community charity we could work to help individuals under our charity banner, and with our standards of good practice we could safely coordinate and manage volunteers. So we liaised with Argyll and Bute Council in their Caring for People helpline and took referrals from them for food deliveries and befriending. We recruited and managed a team of 45 new temporary volunteers who provided help with shopping. So we would match individuals together a bit like a befriending match. We would then match somebody for shopping. So we would support them. We would make sure that they had some references, and we couldn't PVG them or disclose them very quickly. We weren't going to do things like that because we just didn't have time. But we would take references and do as much as we could. We liaised with shops and pharmacies to identify anybody needing help, and it might be worth noting that we couldn't liaise with the GPs, we couldn't liaise with the surgeries, we couldn't liaise with social work because they were just not available. There was no comment. The third sector didn't exist as far as they were concerned, despite the fact that we were out there on the ground. And I think one of the things that we did recognise was that when we were going out helping people to shop as the third sector, we had no legitimacy almost. We didn't have the banner of being with the NHS or an emergency service. We were just people out there, and we were worried as well that we might get stopped by the police and asked why we were out and about. But actually, we were the ones providing those most crucial helplines, and we also provided the council with we managed little volunteer groups to do food deliveries, and we successfully developed novel ways to help clients access money because they couldn't go out to the bank, and yet they were being asked to provide money for shopping. So we saw a lot of mission creep, as I think a lot of my colleagues here today will have felt, in that the people requiring help, especially those with dementia, was huge. We had one chap who every day, his routine is so important in dementia care, and a person living with dementia needs routine, and this chap went out every day for his lunch, and suddenly he wasn't able to, and he died shortly afterwards. People's health declined seriously as a result of not being able to pursue the things that kept them alive and vital during that time. Lockdown was particularly hard on our clients. Paradoxically, some of them who had been very vulnerable for a long time almost coped better with those who were now in that position. It didn't mean that they weren't lonely anymore, but they were more used to it. And yeah, it was pretty awful for most of them because they just didn't know when it was going to end, and they were scared, totally scared. And I think what was really sad was that the focus was on contacting your GP when you became very unwell. There was no focus on giving people their agency and allowing them to take care of their own health, and saying, actually, if you do these simple things, you can be sure that you will be minimising your risk of catching COVID. And so, yeah, what else would I like to say? Yeah, I think the support and advice for the third sector, I think, that's where we went to Befriending Networks, because they were distilling advice down from the government as best they could for our sector. But again, I think that idea of not having legitimacy was very difficult for a lot of us, because nobody seemed to know where we fit, because nobody was banging their pans for the third sector, and we didn't want that. We just wanted to know that we could get hold of PPE, which we couldn't. We had to buy it off Amazon and wait for it to arrive. So that was my experience, Robin.
We'll come back to the impact on your organisations and staff. You mentioned there, I think, shopping and access to food. Was the role you were describing there that your organisation was undertaking in relation to food, was that something that would have been done pre-pandemic, or was this something new as a result of the pandemic?
It was new as a result of it, yeah. We don't particularly, some organisations that provide befriending also provide shopping, but unless we were taking somebody out specifically to do their shopping as part of the befriending relationship, it's not something we offered, yeah.
Okay. And what would your view be on the coordination of food provision at that time? I
think in Argyll and Bute in particular was very good. I can't complain. People were getting almost too much at some stages that didn't need it, but I think in terms of coordination, Argyll and Bute Council was particularly good, and despite having real areas of rurality, they were very good at bringing us all together to coordinate a response, and they recognised thoroughly the impact and input of the third sector, which was really heartening, and they supported us really well. I think they got, in particular, they were able to allow us to access a fund which meant we could work more quickly to do the things that we needed to do. So I had a good experience of that.
Thank you very much. Mr. Miller.
Similarly to Jane, I think working in Argyll and Bute when the pandemic hit to start with, we looked at what our resources were, which maybe unlike some other befriending organisations, we work with a mixture of staff and volunteers. So we had 4 wheelchair accessible minibuses, staff and volunteers. So it was straightforward enough for us to move a lot of our clients on to telephone befriending for a period. So we had some of the staff and volunteers who maybe had their own health issues or their partners had a health issue, so they would work from home and do more of the telephone befriending. We also mailed out newsletters and quizzes and things like that. And other members of the staff team and the volunteers helped out with shopping and prescription delivery. There was a kind of vacuum from about March to June 2020 where a lot of services were scrabbling together to find out what to do, and I think how best to serve the community. So similarly to Jane, we worked with Argyll and Bute Caring for People helpline. They referred people to us who were not already clients. So we said we would help people of all ages at that point in time. So in a general week to week, we would be supporting around 200 referred elderly people. And during the March to July period, there was around about 170 additional referrals from Argyll and Bute helpline, and the help that we gave them ranged from one-off shopping deliveries to shopping deliveries every week to, you know, just giving them a phone and having a chat or things like that. So it varied considerably, and some of those people who were referred during that time stayed with us after that as well. So yeah.
Can I ask you then what you would highlight then as the key impact or impacts that those that you were supporting were feeling at that time? Any specific things that you would...
Yeah, a lot of the people we support, because they are referred as being elderly and socially isolated in the first place. So for a lot of them, although we take people we accept people who are over 65 as a kind of cut-off point, but a lot of them, the majority of them in fact, are in their 80s and 90s anyway, and they have lots of health issues in some cases, so they would not be leaving the house without support in any case. So, but they would be seeing people through the likes of us, or with their families, or with other third sector organisations, or going to things in village halls and stuff like that. So I think that and a lot of older people can't hear that well on the phone, or if you have dementia, then you maybe don't understand, certain things on the TV the same way that people without a dementia diagnosis would. So the in-person contact is crucial for a lot of older people, for those kinds of reasons. So to suddenly have that removed was quite impactful, and I think all of us who are younger, it was impactful for us being, staying at home or whatever. I didn't stay at home because I was delivering shopping, but, during that period, a lot of people were struggling, and the people we support are like that all the time, depending on third sector services or depending on seeing a visiting health professional. But during that period, there was a major decrease in statutory support as well. Home carers who, and I always want to say this, who worked throughout the pandemic, they were masked and gloved and going into people's houses for the absolute briefest periods of time to provide essential cares. There was much less, they didn't have time for niceties. You know, they just had to get round people, so there was less time for them to have conversations and things. So you know, even for the people who required home care support, they were getting considerably less social interaction from visiting healthcare professionals as well. And I think, yeah, in the third sector and the likes of our organisations, we were helping to fill some of those gaps.
Thank you very much. I'd like to move on then, I think, to talk about the key issues and impacts experienced by your own organisations and staff during the pandemic, I think some of which has been touched on already. But this may include, for example, any ways in which your services had to adapt, and I think we've heard a little bit about telephone befriending, for example, as one example of that thus far. Any increase in demand for your services versus pre-pandemic? Any impact upon your staff? Any specific impacts you wish to highlight in relation to those? Any financial impact upon your organisations? That might be the spending of financial reserves or the funding support that was available for you to deliver welfare assistance during that time. Any issues experienced in relation to guidance or in relation to key worker status, or indeed anything else that you feel pertinent to mention. Could I start please on this with Mr. Miller, and then Ms. Sinclair, Ms. Smith, and then we'll come back to Ms. Burnett finally. So Mr. Miller, please, if you would.
At the start of the pandemic, I suppose it felt appropriate for our organisation to provide as much help for our client group as possible, and also for the wider community who were struggling in all sorts of different ways. And it felt that we should use our resources to try and make things better for people. We are absolutely there were lots and lots of organisations changing what they did to try and support people as best they could as well, and all sorts of services and supports and shops and things were changing the way that they worked in order to support people around the restrictions. And in terms of finances, for my organisation at the time, just to explain about third sector finances, we get probably a sixth of our funding from the council, and the rest of it we have to find, which would be external funders and things like that. We don't charge for our services, so clients and families and other people can choose to donate if they wish to, but we don't want to have that as a barrier to people participating. And as it turned out, in the initial pandemic year, we were a number of our long-term funds were due to finish, and they duly did finish in November of that year. But because of the uncertain nature of what was happening with COVID and the way we had provided services in the past, we couldn't fill in funding applications requesting money to take large numbers of older people into the community and use our minibuses to bring groups of people together, because nobody would have funded that at that time, which is entirely reasonable. But as the pandemic went on and things remained uncertain, and we were steadily increasing our services, or those kinds of taking people out, visiting people at home types of services as restrictions would change. Things were still very uncertain, and I think there was quite a big responsibility on the likes of ourselves, in that, we were following government guidelines, we were following guidelines that were available to us from the likes of befriending networks and things like that, but we didn't quite fit into a category. So it wasn't like, if you're a shop, you can open and everybody has to come in one by one and stuff like that. The guidelines were kind of a wee bit looser for us. But I think because of that, and because of the vulnerability of the people we worked with, I think there was extra responsibility on us to be careful because probably 95% of the people we would have supported would have been frail elderly people who would have been in the shielding category, and if they had got COVID, it probably would have been a serious health risk for them. So yeah, a lot of that became quite stressful on our team as well, just having the kind of weight of that responsibility, and because there was additional pressure on us to do more because there was less available for people. So to do more and to work around the restrictions, and visit people outside their houses, sitting on chairs and all that kind of stuff when you could do that. All of these things had to be, constantly risk assessed and change the rules for ourselves in response to what was happening nationally, what was happening from the government guidelines, and balancing that with the damaging effects of continual social isolation and loneliness for our older people who were really struggling with that, and it was having a negative effect on their health, obviously. So to weigh up the risk of COVID against the risk of continuous isolation, that was a major part of what we all did, I think.
You mentioned guidelines, and I just wondered if you had any examples of where the evidence you gave was that you perhaps didn't quite fit in, or it was a bit looser, I think was the way that you put it. Is there an example you would give of where the guidance could have been clearer or should have been clearer in respect of an organisation like yours?
I don't know. I suppose, speaking for us collectively, we probably all do slightly different things, and the guidelines, if they were provided to each individual organisation, they would be slightly different. So at one point, I think, because there was no respite care for unpaid carers of people who were looking after a relative who had dementia and stuff like this, we felt kind of, I don't know, under pressure to some extent to, maybe take out either the cared for party to give the unpaid carer a break, things like that, and you're trying to work within the guidelines to see if that would be possible and what kind of risk procedures you could follow around that. I can't actually remember off the top of my head which point in the pandemic it was, but at one point we were taking out one person on a minibus, and the staff or volunteers were, I don't think the testing was available at this time, but they would take their temperature, they would be wearing masks and gloves, they would be wiping down the van with disinfectant, they would take the person out for a wee while, and then they would drop them home, and then the entire procedure would be in reverse, so you'd be disinfecting the van and maybe take out somebody else. So all of that kind of thing was very time consuming as well, because we had 200 of our own clients to support, and the referrals from Argyll and Bute helpline in the early stages, and whereas we normally would have been taking 8 elderly people out for an afternoon to socially interact with each other and things like that, when you're taking out one person, it takes a lot longer to get round everybody, so yeah, looking back through everything and all the updates that we did over the initial 2 years and stuff like this, it was constantly changing in response to what was coming out from the government, and in response to what was being provided locally and what our elderly people were asking for as well. So, yeah.
And you spoke about, I think, they're feeling under pressure and wanting to do what you could. In terms of the demand on your services, I suppose, firstly, was that increased? And secondly, was your organisation doing things perhaps that went beyond what your traditional remit would be?
I think in the third sector, since austerity, we've always gone beyond because we've had to, because there is no longer the statutory support that there was, and I think COVID made that worse, and it remains worse to the current day. I think statutory services themselves are under vast amounts of pressure. And maybe as a result of COVID, there's recruitment issues, there's financial issues and things like that. So it's not the way it was 10 years ago when I was doing this. You know, we provide social support, but it goes way beyond social support.
And you mentioned financial issues there. What is your view on the financial support that was made available to you to deliver welfare assistance during the pandemic?
There were a number of funds opened up that were quite user-friendly. You know, the simple applications, simple application forms, and quite a rapid response in terms of actually providing funds. Some of our existing funders who we were due to report on and say what we had done with their money following certain remits, you know, like we would be taking 200 people out every week between, you know, certain months of the year. Obviously during COVID we couldn't do that, so our existing funders were understanding that we couldn't do that. The problems for us came after COVID, where there was because we couldn't apply for the funds that we would normally have applied for, because there was no certainty about what was going on. Then we took the decision to provide as much support as we possibly could, so we used lots of reserves, in fact nearly all of the reserves, and that kind of thing puts you in a difficult position, because lots of funders do not accept funding applications from charities who do not hold 3 or 6 months worth of reserves. Your reserves are there for the reason that, you know, when things get tight, then you can carry on providing services, so it felt appropriate to use them to provide as much support as possible when it was most needed. So beyond the first 2 years of COVID, I think that's having quite a big effect still on a lot of charities like ourselves. And, you know, during the initial COVID period, I think, you know, a lot of smaller groups, like village hall groups and stuff like that, would have weighed up the risks of trying to reopen or things like that, as well as loss of income from people using a village hall or whatever, and folded as a result of that, you know. And it's taken longer to rebuild the pieces. It's not just the 2 worst COVID years.
Thank you. Ms. Sinclair.
Probably we were very different probably to what you've heard before, in as much that up with us the Carriage itself and other voluntary sector organisations on UISTs actually worked quite well in partnership together. We were aware of the vulnerable people within our community because of our community being fairly small. I might say at this stage that Carriage has no integrated joint board. We're all voluntary sector funded, so that, you know, we were in a similar position to Robin, in as much that we did have funding that was coming to an end. Again, the funders were very reasonable, but we also established up in UIST something called Resilient UIST, and that was all of the voluntary sector funders and funded services, along with other organisations that came together to ensure that as a community we worked together. So the impact on Carriage itself, we lost
50% of our staff, and I say we lost, they were shielding themselves. They weren't necessarily shielding because they were elderly, but just maybe they had an illness or they had a child that was poorly or something along those lines. So it did actually mean that the staff that stayed working or weren't furloughed, they had a lot more pressure put on them to achieve. An awful lot of what we had been achieving was through volunteers, and trying to support these volunteers during that period was very difficult. So I did find that I was telling staff to really make their presence felt and to come up with ideas and interactions. I mean, we were doing newsletters, we were trying to encourage virtual tea parties, even for people that that did have the ability to get to a computer, those sorts of things. And looking back, it was very challenging for Cowgen from various points of view, but actually the community did really come together, and we experienced an influx of volunteers at the time that actually was really very much appreciated, but fairly detrimental at the end because we lost them all along with a lot of others at the end. So we really did have this situation whereby we peaked and flowed and peaked and flowed.
Thank you. Ms Smith, could we come to you next, please?
Yeah. There was quite a lot of devastating changes within the organisation. I think initially the organisation and individuals adapted really well, knowing it's lockdown, you know, we have to change our processes, and actually putting the new processes into place for me wasn't the most challenging thing. But listening to the individual's impact in the weeks after, in the months after, and then for the years, when you were hearing back from either the staff who do the visits to the clients to see what the needs are, and also to the volunteers who had been providing one-to-one support, who were struggling to manage to maintain that they weren't to go and provide any face-to-face support. So initially, we had no face-to-face support. And then as the individual challenges came in, of somebody phoning up saying, my client has no clue, I'm seeing her at a window when I'm walking past and she doesn't seem to be dressed, I need to, you know, and she's not having any care needs of that going in, what do I do? And for us, we were always used to providing one-to-one support. So it's quite stressful to know that that was happening and to re-look at what was then possible. So for some of our volunteers, they came up with very innovative things. They would leave messages for people. They would start doing notes. They would start online things if their client was able to do that. They would look at ways of managing that dissonance that they had in themselves. But it really did create stress for the volunteers. Some of the volunteers, if they themselves felt that they should be doing more and they had to isolate or they were having problems that they needed to look after themselves, they then felt very guilty that they were no longer providing care or support for their clients. And in particular, because the clients usually had health conditions that were deteriorating and continued to deteriorate, and sometimes deteriorated quicker than we would have envisaged pre-COVID, because they weren't receiving the same level of face-to-face or personal care and clinical care support. And we weren't able to do the social element, which I don't think people always recognise the importance for your health and well-being and your mental health of actually having that social connection. And yes, you can put up things, you know, online or that, but actually in reality, how many of us can really live our full life in that way? So I think for us, the big change for the organisation was learning to read and to look at the guidelines, to listen about what the risks were for each individual case, and to work out a plan that would meet that person's needs to the best that we could meet them, and to support the volunteer or the staff member in the instances when they didn't feel that it was enough and they were struggling with that for their own health and well-being and feeling that they weren't doing all that they should be doing. So they were the kind of challenges that we were faced as an organisation, as well as an increase, as the others said, in the number of requests for support that we were being asked for, which were different from what we maybe supplied before, in that there was much more practical elements of the shopping and the prescriptions and, you know, things like that. The influx of people wanting to help but would the right people want to help, and could we get them through the training and have them matched to the right people when we hadn't been doing as much face-to-face to actually get a real handle on what the people's social needs were.
Thank you. And you mentioned those additional elements, I think you said, that your organisation was providing. Was that something which was funded or not?
We just subsumed it, I think, into our general, in the hospice itself, we subsumed it into our general monies, and we did get monies, financial help back, that was for all of our care, social care and personal care services. So for the core service that we delivered, that was how it was done. For all of our partners, some areas found it easier than others. In fact, some of them found actually getting funding at that time easier than it had been before. There seemed to be less hurdles for them to get through to actually get their funding. So during the actual COVID time, they found it a bit easier. There was less, they could do quicker to tell how the money was being spent, and there was a more understanding that it was going on social needs in a general. Whereas after COVID, as in with the other delegates were saying, there was more challenges again around funding, around managing to secure enough funding to either keep the services that they were doing since COVID, or actually meeting the gaps that for the monies that they had lost during COVID from their reserves.
Thank you. Could I come then to, I think, you now, Miss Burnett?
I think I mentioned earlier about the specific changes that we made, but our befriending organisation, to give you an idea of the diversity of befriending organisations, ours is run by a team of 2. So we were pretty much on call for most of lockdown and beyond. And that was quite stressful at times, because I think, as my colleagues have mentioned, that the stories that we were hearing about people were particularly harrowing at times. And I think one of the things that was very difficult was that people had different approaches to the risk. Some of our elderly felt that they had a year maybe of life left, and they didn't want to be kept indoors, whereas their befriender might have been very risk averse and very rule orientated and wanting to make sure that they adhered to all the rules. And I think as things opened up, for us it began to get more confusing, because this idea of who was in your bubble and who wasn't in your bubble, and if you had nobody who was in your bubble, if the only people supporting you were having to support other people as well, the rules about how you could travel, transport was so important for all of these people who are housebound and have mobility issues. How many people could you get in a taxi? Could your befriender go with you? Would they have to sit in the back? Would the window be open? All of these things that just added to this complete fear-based approach to, you know, what did we do before that? But yes, I think that's all I wanted to add really at that stage. Just apart from, I suppose, one of the major things for us, which you may or may not come on to, was that as people who are used to dealing with our clients' health and well-being, we did know that there was good evidence that was out there in major documentation saying that people who were lonely and isolated were more at risk, number one, of respiratory illness itself. I have the papers relating to that, and that they have less of a response to vaccines if they're feeling lonely and isolated. And yet what were we doing to our elderly, or to everybody? We were locking them up and keeping them away from the things that made them healthy. So that was a big issue for us, because we couldn't understand, you know, a lot of what was being asked of these very vulnerable people. Thank you.
You talked there in your answer about, I think, travel between different authorities, for example. I wanted to ask whether your organisation, or indeed any other organisations you're aware of, benefited from key worker status, for example. Was that something that staff in your organisation would have benefited from?
I think we would have benefited from that enormously, in that we would have been able to, I think, travel more easily, and we would have had, I don't know what the key worker benefits were in the end, because we weren't entitled to them. We just saw other people kind of just having better access to PPE and that sort of thing. So to be honest, those other organisations in the Health and Social Care Partnership just didn't really integrate with the third sector, or not that was my experience and many of my colleagues in that situation in other third sector organisations. So we didn't really know what was going on elsewhere. I think one of the things we could really would have benefited from would have been good distilled local information. So, you know, if you have national information, it's a lot more useful when it's kind of moulded for the local use. And I think that the Health and Social Care Partnership would have been really well placed to do that. And we could have been providing backup information, because most of the time we spent on the phone, we were talking to clients and volunteers about what they were and were not allowed to do, and how they should act in certain circumstances should they get ill. I think one of the most alarming things for me now is that I see many older people who are very reluctant now to contact their GPs, and going forward our GPs kept their barriers up in the surgery for a good 2 years after COVID, and maintained that idea that there was no kind of it was access, emergency access only. That relationship, I think, has been lost for a lot of older people with their health services. Yeah. So I said I had nothing to say, but I'd managed to say something.
Fine.
Thank
While
you.
We're here. Did anyone else on the panel have anything they wished to add on key issues or impacts faced by their own organisations or staff before we move on? Or no? All right. In that case, we'll move on. Thank you very much. So finally, fourth and finally, we're going to move on then to potential lessons to be learned. As I say, this is an opportunity for each of you to highlight anything you think that worked well, and I think we've heard some examples of that today as to what worked well, but also what the Scottish Government might do differently, either to mitigate ongoing impacts of the pandemic or what could be done differently to improve matters in the event of another pandemic or similar event. For this, please, could I start with Ms. Smith? Thank you.
I think one of the greatest learnings that we had was about community resilience and about innovation in individuals, how they can help with the problem solving, and how if we enable them to have the looking at individuals, you know, I know there had to be a blanketness originally, but once that was there and people were starting to look at individuals and their needs and the risks, I think then having maybe, if you have to put out guidance, to have it in a general way that says this is the overarching, however, helping to see that in health, maybe the social, the clinical and the personal care services will come together to make individual plans for you, and focus on that more than having so many blanket solutions or guidance that worked for normal populations maybe, but not for the vulnerable adults that needed the one-to-one support.
Thank you. Ms. Burnett, come to you next.
I think the lessons and the things that we'll take away from COVID are that third sector organisations like ours are very well placed to act immediately and flexibly to provide an emergency response, and that communication is just key in all of it. And I wish we'd had more with our health and social care partnership. But overall, I think the effects are obviously lasting, and we're forever changed as an organisation, both in the kind of clients we're now seeing and the way in which we look at people's health and well-being. But yeah, I think overall, I think we responded pretty well, considering everything that we had to achieve during that time. But it was a challenge, and I think that the challenge is there's residual. But yeah, that's it really.
When you say you're forever changed, and then you mentioned about people you're now seeing, could I ask you just to elaborate that on a little bit further, please? We
were predominantly seeing older people getting referred to us, but now we see a much younger cohort of individuals, mainly with mental health issues, anxiety, depression, and that's just since the pandemic. So we do see we've had to change the way in which we work and the information that and how we train our volunteers and the types of volunteers that we now look for to support those individuals.
And at the beginning of your evidence, I think you mentioned waiting lists. Can I ask whether that has changed at all as a result of the pandemic? Our waiting lists initially went up. They've now kind of stabilised out.
We're seeing a lot more, they've stabilised, and yet we're seeing what we would term in befriending as more people with more complex referral needs. So we're not just seeing somebody who can't get out the house, we're seeing somebody who's depressed, cannot get out the house, and whose partner has dementia. It's very complex now, and quite often I think we're being seen as a last resort, and there's a lot of things happening locally with social prescribing, where individuals attached to healthcare professionals attached to GP surgeries, for example, will prescribe a social interaction, and that's all well and good, but you can only do that with a strong third sector, and if we're kind of under the hammer because we're getting lots and lots of referrals, that's quite difficult. So yes, those have changed, and I think that the emphasis, we now know in society that the biggest those suffering the most loneliness are now the 16 to 24-year-old group of individuals. So that, I think, will predict maybe where we have to take befriending in the future.
Thank you.
Not already. Thank you.
Mr. Miller.
Yeah, I agree with Jane that I think COVID kind of showed that the third sector is very quick to adapt to changing circumstances and kind of knows the people and the geography and all that kind of stuff, the communities very well, generally speaking, as well. We in terms of working with partners from the statutory sector, and yeah, we worked well with Argyll and Bute Council, particularly in the early stages. It was quite nice to build on that kind of relationship, and yeah, other aspects of the statutory services were struggling in the first place. They were struggling before COVID, and that was putting more pressure on us already, and then they were under more pressure because they were having to deal with, the complexities around COVID in hospitals and GP surgeries and stuff like that. So people needed more help from the likes of ourselves, and to a large extent a lot of that has continued, because I don't think statutory services have ever got back to what they were before, and they were struggling at the time. Other lessons to learn without sounding too political, if that's okay. I think there's people profiting out of COVID should not have been allowed to happen, and they should give the money back. Because there were a lot of people sacrificing a lot to look after people as well as they could with very few resources.
Thank you. Last but not least, Ms. Sinclair.
I'd probably start by actually agreeing with Susan that basically from where we were sitting, because we were so culturally different to other parts of Scotland, that actually with regards to guidelines and understanding that if it had been brought to a more local level, we would have been able to have a greater impact. I think also something that hasn't necessarily been touched on and I'd like to put forward is the long-term impact on staff. I sat down with my team when coming here just to make sure that I've got my own memories, but I want to make sure that I'm covering everybody's, and I did have members of staff in tears 3 years later from the experiences that they'd gone through and the feelings that they'd had. And something that we've had as a consequence of COVID is that we have had to change the model by which we worked with. I mean, the befriending model is very much a one-to-one, and had been before, but we because of the fact that we did have this influx of volunteers and there was this great assistance with telephone befriending and people pulling together, post-COVID we lost not only those folk who had joined us then, but also a number of the folk previously had lost confidence or their circumstances had changed. So our volunteer numbers plummeted hugely, and our referrals were larger and larger because of there was suddenly opening up and this need whereby people really did need interaction and for their own health and well-being. So we went on to the model of group activities, much more so, but that brings its challenges as well because of mobility issues and transport and rural areas and that sort of thing. So the cost of doing that was greater. So the funding pot was more difficult. But we actually now, where we're at now, it's beginning to balance out, and we are in a position when we get a referral to actually, where the individual's concerned, work out in their plan whether they're better with a one-to-one or whether they join at a group activity.
Thank you very much.
Could I just add to that?
Yes, of course, please.
Stephen, that although our referral numbers have evened off, I would concur with Joe completely that our volunteer numbers have dropped so considerably, and I think that's echoed across the UK, that for various reasons, whether it's now that people are got 2 jobs or they're just financially not capable of volunteering, our volunteer numbers have plummeted. That we've only had 5 new volunteers this year as an organisation, which means we can technically only provide 5 new matches, and that's 50% less than what we would normally hope to provide.
And that's something you attribute to the
Definitely,
pandemic?
it's definitely post-COVID, whereas you had that big influx in the beginning. Those volunteers did not remain. They went back to work, they went back to their normal lives, and now we're seeing 2, 3, 4 years later that those volunteer numbers, as the cost of living has increased, our volunteer numbers have gone down. So our ability to do our job and to actually meet that increased need and diverse need is now much harder. So I just wanted to add that.
Thank you.
Thank you.
Well, Lord, I don't have any further questions for the panel. Subject to anything you wish to add?
No, I've got no questions and I wish nothing to add. Simply thank the panel members for their attendance here today. I'm very grateful. So that brings an end to proceedings today. We'll adjourn till tomorrow morning at 10 o'clock. Thank you.
Thank you, my lord.
Thank you.